Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course.
Today we are going to cover the 10-minute lower back pain stretching workout. So this is going to be approximately 10 minutes. We're not going to time it, but we're going to go over enough exercises. We're going to do at least 11 exercises.
11.
Yeah.
Bonus.
Yep.
There you go.
So that, if each exercise takes about a minute, you're going to be done in 10 minutes and your back's going to be ready for the day.
If we could quit talking so much, we might get it done in 9 minutes.
Yeah.
That isn't going to happen.
By the way, next week we're going to do one on purely strengthening. No strengthening today. This is going to be all just stretching.
Get those muscles to relax.
Yeah. So we're going to kind of go, a lot of them are going to be beginner, and then we're going to go up to maybe a little more advanced on some of them.
Yeah.
Some of them don't have an advanced. So we won't do that.
Right.
If you are new to our channel, by the way,
if you are,
please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Hi to everybody on Facebook. Facebook, you feel the vibes?
I think they're liking us, Bob.
Yeah, they should give us the thumbsies or the heartsies, something like that. Question and answer.
Yeah, they provide the questions and somebody provides the answer. I don't know if we will, but.
And we will answer questions on relationships, too.
Yeah, and we're pretty good at that now.
Yeah, really. Okay, let's get started, Brad.
All right.
First one is we're going to just do what is called a pelvic tilt. Do you want to grab that spine, Brad?
Yes, I do.
Kind of show.
Yeah.
Line it up with me. So you're going to lay down. This is the one you can start waking up in the morning, and I want to just get a little bit of movement in the pelvis.
Right.
So Brad's going to show you what the pelvis is doing.
Are you going to do a posterior tilt?
Yeah, I'm going to posterior tilt. So I'm going down like this. So I hope that makes sense. Basically, one way to tell if you're doing it, if you put your hand underneath into the arch of your back,
right,
you're trying to squish my hand.
Yeah.
And again, that's just warming up. It's great that you should know where your pelvis is at, especially when you're doing lifting and stuff like that. Usually we want to have a little bit of arch in the back,
right,
so you can move that pelvis like this. That would have been better with my belt, wouldn't I have?
Yeah, we did your colored belt. What were we thinking about? But one thing you say, what does that have to do with your back? But if we look at this a little closer, when you do that pelvic tilt, there's a lot going on with your low back as far as movement.
Yeah, you're actually opening up the little facet joints and,
right,
and the little holes where the nerves come out.
Right.
So
it has a lot to do with how your nerves are being or not being pinched. Be
go.
Careful with that, Bob.
All right, next one. We're going to do trunk rotations. Most of our back patients, we have them do this one. Just about everyone can do it. You can start off, you bring the legs up into this position here, and you just start gentle, rotations. Maybe not spanning that far. You'd be better off being turned, Richard.
Yeah, let's give them this view because we had a few comments saying we can't see what's going on with your legs.
So, yeah, I'm going back and forth like this. Now, if it hurts going this direction, I'm not going to do that one right away. I'm just going to work on going to the right until this one loosens up, and then I'll go back and test it again. Now,
your legs are really white, Bob. You can see
I
that
know.
Really good.
Yeah, I try to get out and golf. So
you wear shorts?
Yeah.
Must have been cloudy.
I do use spray.
Okay.
So anyway, you can go like this. Now, if you want to go a little advanced, you can actually bring the leg up and go across now, but this really is advanced.
Right in through here.
Look how I'm keeping my shoulder down like this.
Right there.
But this is an aggressive stretch. I wouldn't want you doing this one right away.
Right. This should feel good while you're doing it.
Right.
Feel like a good stretch in that low back. If it doesn't, you're not ready
Let's
for
show
it.
this one from the side too, Brad.
Sure.
So sometimes if you have pain down this leg, if you go like this, it'll open this side up.
So it's the opposite. You're bringing the left leg over, the right side is being open.
The farther you bring the leg up like this, the farther up on your back it goes.
Sure.
Sometimes people hook underneath their knee like this, and they go like this.
And see how this shoulder right here, if we push that down, that's going to even emphasize that stretch.
You could get a couple nails and nail it down, Brad.
Yeah, or just, you can have your wife sit on that shoulder. And,
This is a family show, Brad.
Well,
Where are you going with
It's
this?
all good, Bob.
All right,
It's
we're
all
going to
good.
the next one. This is really almost more the mid back, but you're getting some low back here too.
Sure, yeah.
So we're doing cat and camel. Just a great one to warm up.
Get that arch up there, the rounded, and then the arch.
To emphasize it, you know, to make it a little more dramatic, I usually go down like this with my head
Yeah,
and then go up like this.
right.
So
I'm trying to see how that's showing up on there.
Is
Can
it
you see
showing
it
up?
pretty good, Liz? Looks like you're having some kind of convulsion.
yeah, I feel like I'm doing a little seizure there.
It is good though for that back.
Okay, then we're gonna go right into the press up. This is one that we really like for most people. Again, couple instances in which you may not want to do it: spondylolisthesis and spinal stenosis. But you're gonna go ahead. You can start off just this way, and maybe you do a little bit of press up like this, and then as you get more advanced, you can go ahead and get the hands underneath and you're gonna start stretching like this. For a lot of people, this is gonna be the one that does their back the most good.
Sure. Typically, the older you are, if you're in your late 50s, 60s, and over, Bob's really flexible for his age.
Yeah,
but,
that's because I do these a lot.
right.
So-
He maintains it.
Yeah, a lot of you are going to be doing this.
Yeah.
Your pelvis is going to be coming up because you're not going to have enough flexibility. So work this range first and then here, and then. But again, we're looking for that. After a while, it actually loosens up and feels there's no pain while you're doing it.
Right.
So you can also get to the point where you're advanced on this too. You can take a strap. This is the stretch out strap. We usually have it listed down below in our products.
Yep, it's there.
Amazon products, but it's got loops here, so I can put my hands in the loops, and I can go ahead and you can use a towel too.
Yeah, you can use a towel roll. The big advantage of this is if you have problems with gripping, this is much easier on your hands. You get a good, solid, easy hold.
So now I'm getting a little counter pressure on my back, and I can try to work different levels here. You can actually
Can
run.
you see that, Liz? That strap is a little bit hard to see through the arm, but we don't want to cut your arm off.
You actually could run it through your belt loop.
Oh, sure.
Especially this size.
Yeah,
So,
that maintains where the position it is.
all right, I think we're gonna let Brad do some work for now. Why don't you
I
go
was
ahead?
enjoying my easy
Your
roll.
easy life?
Yes, the easy life. All right. So again, that previous exercise, if you get stenosis or spondylolisthesis, that's not for you. These are the ones that are more likely going to help you. Because I have spondylolisthesis and stenosis in there, and these are the ones I do. I never do that one. I used to years ago when I didn't have that issue. So single knee to chest, opposite leg is down flat, and then this leg you're going to bring up, and you're going to gently pull. If you're tight, you may have to use a strap. Where'd that strap go by?
Right there.
And I have this happen with a number of patients. They can bring their knee up, and for whatever reason, they don't have the flexibility of long enough arms, or they're, just a little chubby in this area. They can't reach the leg very easily. So then you take a towel roll or strap or a belt.
Again, you could do it with the towel. Again, you could.
Yeah.
You could just.
Yeah,
Yeah.
whatever you can whatever you can get a hold of, and then you can pull it that way and use it. That feels good. Make sure you do both sides though. And it's not uncommon to find one knee or one hip is tighter than the other. So you're going to go after the one that's tighter. In other words, it doesn't come close to your chest.
With all these, if they hurt, if they make your back pain worse, you don't do them.
Right.
I mean, want to keep emphasizing that. Want to make sure you're breathing too when you're doing this. Yes.
I want that strap. Okay, now once you do one knee and things are feeling pretty good, then you can step up to both knees coming up at the same time. And boy, this feels good to me. I can tell you that right now. Oh, my goodness.
Hugito 165 says, can a pelvic tilt misplace your disc? I would say unlikely. If you're having a disc problem, I don't know if I'd do it. If you're having a disc problem, I'd probably go ahead and do the back extensions, the one where you lay on your stomach and do that.
Sure,
But
yeah,
there's not really enough motion for it to displace a disc.
yeah.
So I certainly could try it.
I did want to mention repetition. I don't think we've mentioned that. For most of these, it's going to be between 5 and 10 repetitions. If you're the person that likes to hold it longer, usually you do less repetitions, it might be 5. If you feel more comfortable with the pressure on, pressure off frequency, you may be up to 10. And you could go more than that if it's feeling really good. But typically it's not 30 or 40. That's overdoing it.
No, and you're busy, I'm sure. Everybody's busy, so you want to just try to knock these off in 10 minutes, so you don't want to be spending more time than that.
Precisely.
So Brad's going to show a little more of an advanced one. Brad really likes this one. This one has worked well with his spondylolisthesis, and also his spinal stenosis.
Right. Matter of fact, I learned this one from an advanced course on back stretching for stenosis specifically, but it works for both. And you put the towel rolls. It's really important. Do not put the towel roll above the belt line. It's going to make it worse, and it's going to be uncomfortable if you go way up here, and it already doesn't feel good. You're going to keep it below the belt line, about 2 to 3 inches. It's going to be anatomically on your sacrum. And I know a lot of people may not be familiar with that, but it's down a little bit lower. There's a bony area there, and you just lay into it, and you can start out here and start bringing one knee up to the chest, and it should feel good. It should feel like a good stretch, relieving stress and pain off the low back. If it's not doing that, don't do it.
Teresa Hawkinson, by the way, is wondering, she wears a back brace, and she's wondering if she should take the brace off before she does these. And yes, absolutely, take the brace. Now, if you have a brace on because you fractured your spine, then of course you don't take the brace off. You don't do these. But if you have regular run-of-the-mill back pain, you would take your brace off and do these stretches.
Yeah, so, if anybody has had surgery or anything like that,
right, you got to get this all cleared.
You need to clear it with your doctor, and oftentimes you're going to go to a therapist directly to make sure there's no issues. Oh, this feels good, Bob. Do I get to keep going?
Oh yeah, I think you got it. Did you do a hamstring stretch yet?
Nope.
Well, keep working, Brad.
I'm sorry. I could do that one for another 5 minutes.
Yeah.
But we've got to go on to
I'll take a question here, Brad.
Okay.
Urban O'Hara. He's from Ireland, surprisingly.
I like Ireland. I want to go there.
Yeah. He has a herniated disc, and he's been following our videos with great success. How long before he can go jogging again? Yeah, you're going to want to be careful with that one. I would start with brisk walking first.
There you go.
And then when you do start jogging, you're going to want to do very short distances to start off with. No hills.
Right.
And you want to see how your back responds.
Right. And you may want to progress as long as it's on the flat. It goes good for a 5-10 minute jog. You may want to start with a walk.
Yeah.
A walking running interval.
Yeah, that's a good way to start, Brad, would be to maybe run just for 30 seconds.
Right.
And then walk and then see again how your back responds.
The big thing is don't overdo it on the first day. Because if it feels good, you think, oh, I'm going to run a mile. And then the next day you'll wake up and you may be set back.
Pay the price. So Brad's going to show a hamstring stretch. There's a number of ways he's doing it. Right here, he's just, he's supporting the leg, and then he's pulling that foot towards him as much as the hamstring will allow.
Right. And this can be made much easier if you have a belt or a strap. I'm gonna go to the stretch out strap because it really works better. I'm gonna put that around the foot.
While he shows this, the reason we want to stretch the hamstring goes all the way and attaches into the pelvis. And if they're tight, when you try to lift things or do things, it's going to pull your pelvis back and put it into a bad position.
Sure.
So hamstrings are. It was what I saw a study where there was 3 muscles you definitely should stretch with back pain.
Yeah.
The hamstring was one of them.
Yeah.
And it showed improvement.
Right. And that has been, I think even 20, 30 years ago when we were in school, that was very common then. Now with this one, I'm going to keep my knee straight. If I go like this and bend the knee and I try to stretch my hamstrings, it won't be effective. Keep the knee straight and gently bring it up. And this one, I do like to hold it a little bit longer. And some people will say hold up to 30 seconds. I don't like to hold that long. I'd rather go hold for a few seconds and then off and on and off. And then there's a contract, relax method. I know Bob likes this one.
Yeah.
Where I'm going to push down in this direction. I'm going to hold it with my hands. This is where the stretch out strap really pays
off. So
the
muscle's actually tightening up, but he's not allowing it to move. And then when he relaxes, he can actually stretch a little bit further.
Yeah. And you're going to do the contract part for about 5 to 6 seconds, then relax, pull it up.
So Tina Stewart wants to know, how do you hold your head when you're doing these exercises? Chin tucked or neutral? I'd say either is fine. You're not really worried about what the neck is doing.
Well, you know, you're not going to be way up like this. You want to be relaxed one way or another.
Yeah.
Oh, one thing we didn't mention yet, Bob, with all of these stretches, it's very critical that you breathe relaxed. If you have shallow, tight breathing, you will not stretch near as well, and the whole body will.
I'm starting to worry about your memory, Brad, because I did mention that earlier. But
well, I must have been.
We're going to sound like a bickering couple here.
Sorry, Bob.
All right, I'll go on to the next one. Okay, Brad. So now we're going to do a hip flexor stretch. Same thing. This muscle tends to tighten up on, especially people who sit a lot. It's going to pull the pelvis down if these are tight. And it's going to put you, over time, put your back into a bad posture. So even though this is kind of a muscle that seems like it has nothing to do with the back, it does. So a simple way to do this is just to put a pillow on the floor. You're going to go ahead and kneel down. And I'm stretching this muscle right here. And I lean forward here. I'm keeping good posture. There's other ways to do this, but
straight posture here.
If you want to get a little extra stretch on it, I go this way. You put the leg, watch how I turn the leg out like this.
There.
That actually will put a little extra stretch on that hip flexor.
So from here over to there.
So and you want to make sure you do both sides. Otherwise, as Brad most famously says, you'll end up walking in circles.
Right, because I know from experience, so I've done a lot of circle walking.
Do you want to grab the thing for stretching the heel cord, Brad? Isn't that right over there?
Oh, yeah, the incline board?
Yeah, Brad made this, by the way. Brad's very handy, and we did a video on how to make your own.
Right, yeah. You can purchase some. They're about 20, 30, and sometimes more. If you want to make your own, we got a video on that. If you're handy and got some wood, you can make it for very little.
So it's the same issue here. If your heel cords are tight and you're trying to lean down and pick something off the floor, it's not going to let me, if I don't have mobility in the ankles. So you want to make sure your heel cords are stretched out too. And yeah, you can go up to a step and just put your forefoot over the top of the step.
Here, use something to balance.
Sure.
I find that better.
But this board works out really good. You can really, and again, I stretch this every day, so I think I got decent mobility in there.
Yeah, I would say you're well above normal. And whether you're people who walk a lot or run a lot, particularly really benefit from this. But also with the back, like Bob says, the mechanics of the ankle affect the back mechanics when bending and lifting.
Yeah, if you're a weekend athlete, I would recommend you stretch the heel cord a lot. I see a lot of people that injure that heel cord when they try to do sprinting and they haven't been.
People who play softball on the weekend, and they sprint out at first, and they hear that pop in the heel cord, and the next thing you know, they're in for surgery.
All right, the last one, the bonus one we're going to do is the quadratus muscle. And you're going to lean over like this, and it's going to stretch here. You can probably just sit on the edge of the bed like this and bring this arm over, and I stretch it. What I do in the morning, I put my one foot up on the step, and I lean over like this. I stretch my hip adductor, and at the same time, I stretch this one.
So you're standing?
Yeah, I'm standing.
Sure.
So, again, I grab it over here. Brad's going to show it in the chair.
So, in a chair, it works better if you have armrest. If I'm going to stretch my right QL quadratus lumbar, I'm going to take my left hand, reach across my body here. I'm going to reach up over like this. And it works better for me if I lean to the side and slightly forward. And I'll kind of work that. You'll feel that stretch in that muscle. So we're talking about right above the belt line, close to the spine, right where my hand popped there. And I actually like to if you take a cane or a stick like this and you reach really high up on there and then just relax. And it really does an extra nice job there. Plus, it gets the shoulder. If you have shoulder problems, you're not going to want to do this because it may irritate it. We've got some good videos on shoulders that would actually treat with this, but that's another story.
All right, I'm going to start grabbing some questions here, Brad.
All right.
So Heidi blinks. What can she do to stop painful cramping in her legs? I guess first you want to make sure you get a diagnosis. In your legs, you might be having some, atherosclerosis building up in the basically the pipes are getting blocked up. So you want to make sure you have a diagnosis. If you're getting nighttime cramps, a lot of times, we did a video on this. One of the things, you might not be drinking enough water.
Sure.
You may want to do some stretches on your calves
Right.
before you go to bed at night.
Yeah. So if they're using the incline board as a good option.
An incline board would be a good option. But again, I can't emphasize enough that you better make sure that you get a diagnosis here.
Right.
So,
Yep. Get it figured out from a professional.
Mary Denny, her right side is in agony. Never had that with any seat chair. No idea how to solve. So one thing, she's going to use a back support, right?
Right. Lumbar support.
I suppose
she can start out with taking a towel.
you want to grab that chair, Brad? I could grab a couple of the supports.
Okay. Yeah. So normally I like mine a little bit lower, and for me, I've got a little bit of stenosis. I actually use a larger one like this.
This is a memory foam one.
It's larger. It's spread out more across your back, and if the towel roll works good, this probably won't work. They kind of are opposites as far as supports. And there we go with that. So hopefully that'll give you something to work with to help you in that car. Because I noticed, like, driving a car and you get pain down that leg, it's no fun.
This is a guy, Robin. Make sure you don't have a wallet in your back pocket that you're getting pressure on your sciatic nerve, by the way, too.
Either that or go spend some money so it's not so thick.
I can't find the question now, but somebody had asked, how can you tell whether or not stretching is going to help versus strengthening for their back?
Yeah.
And for most people, I first try to see if we can find a movement that'll help your back.
Right.
So I don't worry about strengthening or really somewhat stretching. Is there a certain movement that takes away your back pain? That's the first thing you should look for.
Right. Either takes it away or clearly reduces
it.
Particularly if you got symptoms of pain down the leg, if it makes the leg feel better, boy, that's going to be a key movement.
So all the ones we did today, if you find one that takes or reduces your pain, keep doing that one.
Right.
You can focus and just do that one alone.
Sure.
Should we take one from Liz? You got a question, Liz?
Sure. Linda is asking, is the heel cord what is tight with plantar fasciitis?
Linda is asking if it's the heel cord that's tight with plantar fasciitis. I would stretch the heel cord,
right,
but ideally, you really want to stretch the plantar fascia. So the number one stretch you should do with plantar fasciitis is this one. So I got my sock here. Hopefully you can see because it's white. So you're going to go ahead and you're going to grab the top of the foot like this, and you're going to pull. You're going to stretch the toes and the greater toe and all the little toes at the same time. I would do this stretch before you even get out of bed in the morning.
Sure.
I've stretched it a bunch of times. I would stretch it at night. I would stretch it when you're sitting in the chair for a while. I would do that's what's nice about this stretch. It's easy to do.
Stretch it at work?
I've stretched it at work, absolutely, before you get up. Because usually plantar fasciitis, you have that thing where you get up and it hurts.
After you've been sitting or in bed for a period of time.
So have your shoes right by the bed. Do the stretch and then put your shoes on. Don't ever walk around barefoot when you have plantar fasciitis. You got to let that heal up. So
we do have a number of videos with complete treatment guidelines on plantar. So
some people
Google Bob and Brad plantar fasciitis and you'll get a whole playlist.
Yeah, you'll look at there's a night splint that a lot of people wear that really helps. But that's the stretch you want to do.
Sure. Yeah.
So did you have any more, Liz? Or
Rob said, I find my pelvic tilt is quite painful and standing around is so hard and frustrating. Got any good tips for the hips and in that area?
So Rob said that he finds the pelvic tilt is actually painful and that standing around actually hurts. You want to show your standing stretch, Brad? Maybe that would help him. The one where you put your one foot up and lean forward stretch?
Yeah, you could. We'll do it on this chair.
Sure. It's going to be an experiment. You're going to try and find out what helps with you with standing. Right. This might help. This may not help. This might make it worse.
So, usually it's like if it's one side, if it's the right side of your back hurts more, you put your right leg up like this. You can do it on a solid chair with armrests, works well. And you're going to stretch like this. But again, you're only going to do this one if it immediately feels like a good stretch and it's like, oh wow, this is really working. If you get that response, then you're gonna stretch this, and I'll work it like this, or you can hold it for 10 to 15 seconds and come back. But if it hurts while you're doing it, or when you're done doing it, it's not the right stretch.
Right.
It should feel good, and it should just make relief throughout the whole stretch. And again, after, how does it feel for the next 10 minutes afterwards? It should continue to feel good.
So Althea McNabb, she wants to know what kind of stretches to do with a strained pulled ankle. She injured it while she was bowling.
Oh,
So
you're gonna have to quit bowling.
yep. No. The first thing you want to do is make sure the ankle is protected. So
Sure.
I would probably wear either an ace wrap it up. We did a video on how to wrap your ankle properly after an ankle
Right.
strain, or you could go ahead and buy a brace to go ahead and protect it.
Right.
And that's what you're going to want to do until it calms down. And then you can start some strengthening, which we again have a whole video on. But one thing we have people do is bring the foot up, and you actually do the ABCs with the foot. So you're doing A, B, C, D. If there's a
If there was a piece of chalk on the toe, you imagine there's a chalkboard there, and you're gonna draw a capital A and then a capital B. What that does is gives you good range of motion throughout all planes of the ankle joint from a therapy.
yeah, and then eventually you can do the heel raises and the toe raises, and we do this one going back and forth. This helps strengthen the ankle. So
Some real simple ones you can
Right.
do without having special equipment.
right.
And they can be real effective. Again, we've got a number of videos on those as well, so I can go into more detail for
But
you.
you may want to continue to wear that brace while you're bowling.
Right.
I mean,
Sure.
to be safe. So, Liz, you got one more or not? Sure.
Gladys is asking, when stretching the back, should a person stretch and hold, or do the quick bounces the way you showed us?
So Gladys wants to know, when you're doing the stretches, should you do a prolonged hold or should you do the quick ones?
Right.
I would say with a lot of them, what you want to do is kind of what we say pressure on, pressure off. So you're pressure on and then pressure off. So like the rotations.
And usually we don't do too many things with the quick bounce.
So I'm pressure on, pressure off, pressure on, pressure off. If I'm doing extensions, like this way, yeah, move those out of the way. Again, I'm doing pressure on, pressure off, pressure on, pressure off. Now with the hamstring stretches and the other stretches, with those you could probably do a little bit of a prolonged stretch.
Right. I was thinking that with the heel cord.
Yeah, the same with the heel cord.
Hamstring stretch. It's a good question, and there's no definite answer across the board. It varies person to person, muscle to muscle.
All right, I think we better call it a day, Brad.
We got work to do. We
Yeah, we
got
got work to
patients
do.
to treat.
Join us next week. We're going to do the one on strengthening, and enjoy the day.
Yeah, enjoy.